Welcome to the Catheterization Suite at Jehangir Hospital, a comprehensive 4,000 square feet state-of-the-art facility designed for advanced cardiac, neurological, and peripheral intervention procedures. The Catheterization Suite is equipped with cutting-edge imaging technology, allowing our teams to visualize with precision, ensuring accurate diagnosis and guidance for complex interventional procedures. This advanced facility features 2 catheterization laboratories.
We have set a new cath lab, and this is one of the best cath lab available in the world. It is Azurion Clarity. It has got many features which the older cath labs don't have. You see, the monitoring system is advanced, the angiographic clarity is very good, and it has integrated many features like intravascular ultrasound is integrated. OCT, which is an imaging technique, is also integrated in this machine. So therefore, the imaging is better, the quality is better, and you can do a procedure in shorter time with low fluoroscopy and low radiation to the patient and to the doctor. You can integrate this machine, you can integrate all the machine. Here we have rotational atherectomy, which we are doing routinely, and as age is advancing, more calcified arteries, rotational atherectomy can be done, imaging can be done with OCT and IVUS, and it has become very important to do angioplasty with image guided. And all these features are in this cath lab. We have integrated together, and now we have 2 cath labs. The older cath lab is also upgraded to this level, and therefore we can do procedures any time of the day. We have in Jehangir a dedicated 24-hour service. So therefore, if the patient comes at night, we have a staff which is available in the cath lab, and we can do a procedure. As you know, the faster it is done, the better is the result. What we call time is muscle, and if you can save muscle, that is the achievement.
It is equipped with a spacious console room. The suite includes pre- and post-operation areas.
When it comes to Jehangir Hospital, we have a good integration of not just technology, but also personnel, very well-trained staff, and staff which is very skilled at what they do. The main thing is when it comes to complex procedures, the kind of procedures which are rejected by other places, or the kind of procedures which fail or are very technically demanding, are the ones which are taken up here as a challenge. And we do have the technical expertise to try and bring about a new wave of life for those patients. We have technology like rotablation, orbital atherectomy, IVL. So all these technologies are used here day in and day out, and the entire staff is skilled at it. Also, when it comes to left main bifurcations, left main procedures, which is a very important subset of coronary artery disease, this also is tackled relatively consistently here, and we are all well versed in it. If at all a patient requires, say, a balloon pump or an impeller in patients who are very, very bad in terms of their blood pressure, those who are crashing, these kind of patients are also tackled here.
A radial lounge.
So just to tell you, we just now have done one patient who had done through a radial angiography route. Patient you probably have seen, patient has walked from the cath lab suite to the radial lounge, and then we are getting radial lounge chairs where patient can be given experience of, after the angiography, patient can sit in the lounge chair, have their tea, coffee, lunch, the sandwich or anything, and go home within 2 hours. So this is going to be kind of an experience for the patient where where we most of the people have phobia of angiography. How long does it take? What is it done? We don't have to lie down straight, not moving the leg for 6 hours. Much more comfortable, convenient for the patient, and can be discharged within 2 hours. A really daycare procedure, what we call, is a radial angiography.
An in-house pharmacy and consultant chambers.
We here at Jehangir are doing complex coronary interventions. We are doing structural heart disease interventions like aortic valve replacement to the intervention route. We are doing here OCT, IVUS. These are imaging interventions, making patient's prognosis much better.
We should be able to increase and do better interventions for a myriad number of diseases, and these would be anything from complex aortic diseases to hepatobiliary interventions, liver transplant interventions, kidney transplant interventions, dialysis access, gastrointestinal bleeds, tumor embolizations. These are just a few to name. And of course, we have the routine uterine artery embolizations for bleeds. We have the prostate embolizations for enlarged prostates, and what have you. The list is almost endless.
The suite boasts the latest imaging technology and intraluminal capabilities, ensuring precise diagnosis and guidance for complex interventional procedures for both adults and pediatric patients.
Actually, we are planning to expand our specialty in pediatric to the neonates and the infants, even in the preterm kids, doing piccolo device closures and all this stuff. So, for that, we require really a precision to make sure that we are visualizing the devices and the vessels properly. So that for that purpose, we have upgraded to the newer Azurian Philips machine. And yes, definitely with respect to that, we have specific neonatal unit and the pediatric cardiac unit that will take care of all this stuff. We have experienced pediatric cardiac anesthetist and the pediatric ICU team, that cardiac ICU team that will take care of the kids. Definitely, we are doing the regular procedures in the pediatric cardiology over here. We have done the ASD, VSD closures. We have done the balloon procedures over here, and we want to expand to the neonatal unit, like doing the piccolo in 1,000 grams and 2,000 grams kids, and even doing the smallest vessels closures without operating and through the transcatheter procedures. Even we are planning to do this stenting wise, PDS stenting and RVOT stenting. Our background team, particularly the ICU team, is really robust in the particular aspect, and we are going ahead with that.
A comprehensive state-of-the-art facility designed for advanced cardiac, neurological, and peripheral intervention procedures. This facility operates 24/7, supported by specialist doctors, in-house anesthetists, and a dedicated team of specialist support staff.
Anesthesia role becomes very important in managing the patients because we have been taking neonatal, infant as well as adult patients with various complex congenital heart diseases also, apart from the normal PTCA and the various structural heart diseases, for example ASD device closure we are doing, and then we are also doing microclip and the tower, that is transcatheter aortic valve replacement, wherein the assistance of anesthesia is very important, in the sense that we are providing transesophageal echocardiography, beat to beat hemodynamic monitoring, and then the ventilatory support. So we can manage all sorts of emergencies as well as planned cases. And the near future, the plan is to have a hybrid facility also, where we can take the complex cases in the suite itself.
In our comprehensive cath lab, a wide range of cardiac and vascular procedures are available, including coronary angiography, visualizing the coronary arteries to detect blockages or narrowing, angioplasty and stenting, opening blocked arteries with a balloon and securing them with stents to maintain blood flow, TAVI, mitral clip, electrophysiology studies, assessing the heart's electrical system to identify abnormal rhythms, pacemaker and defibrillator implants, placing devices to help manage heart rhythms, peripheral vascular interventions, treating blockages in blood vessels outside the heart, such as in the legs. At Jehangir Hospital, we are dedicated to providing exceptional care with 2 advanced catheterization labs and 24/7 availability of expert specialists backed up with our intensive care units. We respond to emergencies swiftly and effectively. Our catheterization lab has earned a reputation as a center of excellence, specializing in complex procedures that set new benchmarks in care.
We are the ICU intensive care who are always in the background and always giving support for the critically ill patient, and we'll be very, very happy to take care of all these patients in the post-intervention period.
The catheterization suite marks a significant new chapter in patient care at Jehangir Hospital.